Hello and welcome. My name is Danny Laprise and I am a clinical librarian at the University of Louisville Kornhauser Health Sciences Library. This webinar is health literacy and your role as a healthcare provider. We wanted to bring attention to the importance of health literacy and more specifically what you can do as a current or future healthcare provider to address and support patients with low health literacy. So why is addressing low health literacy so important? The simple answer is that low health literacy leads to poor health outcomes. Those with low health literacy are more likely to delay seeking treatment, more likely to visit the ER and be repeat visitors, have increased and longer duration hospital stays, and be less likely to or able to follow discharge instructions and treatment plans, including taking medication properly, which often requires reading and numeracy skills. A recent study showed that between 19 and 30% of patients take medication incorrectly at home due to not understanding instructions, and these percentages increased with the number of medications that the patient was on. These issues often compound and ultimately lead to higher mortality rates among those who have lower health literacy. So I asked the question, why is addressing low health literacy so important? Think about the everyday things we do that require a minimal amount of health literacy, such as reading and interpreting nutrition labels, taking your child's temperature, reading safety instructions, or trying to decide what preventative screenings you or your family members should have and when. Are you high risk? How do you know? Not being able to perform these seemingly mundane activities that we take being able to do as a given can have drastic negative effects on those with low health literacy. Our objectives and agenda for today are to define health literacy and cover some basic information, such as who is affected and factors to consider when measuring health literacy. We will discuss the importance of cultural awareness and cultural competence in communicating with patients. We're going to examine your role as a healthcare provider when it comes to the health literacy of your patients. And lastly, we will take a look at some online resources for both you and your patients. Let's look at some early definitions of health literacy. In 1998, the World Health Organization defined health literacy as cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand, and use information in ways that promote and maintain good health. This definition was revised in 2004 by the Institute of Medicine, stating that health literacy was the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. These definitions put the responsibility on the individual to self-manage disease and overall health. In 2010, the definition was revised to include the word communicate, stating that health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand health information and services in order to make appropriate health decisions. The addition of communicate begins a shift from personal patient responsibility to a shared responsibility between the patient and the healthcare provider. In 2020, the definition was once again revised. It goes a step further from previous definitions by separating health literacy into personal and organizational responsibility. At an individual level, we look at the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions. At the organizational level, we look at the degree to which organizations equitably enable individuals to find, understand, and use information to inform health-related decisions. As a healthcare provider, you fall under the organizational category. This current definition makes a few distinctions. It emphasizes the need for people to have the ability to use health information rather than just understand it. It focuses on the ability for people to make well-informed decisions rather than appropriate ones. It incorporates a public health perspective, and it acknowledges that organizations have a responsibility to address health literacy. When addressing health literacy, it is important to remember that the health literacy of individuals is fluid and can change with context, experience, and their understanding of how organizations such as the healthcare system work. The most current information we have regarding the health literacy of U.S. adults aged 16 to 65 is a report from the Department of Education from 2003. On the scale on the left, we have a grade from 0 to 500, which puts the survey respondent into a category of below basic, basic, intermediate, or proficient. To the right of the category, you can see examples of the types of questions that were being asked. The scores next to the questions are averages of adults who had a 67% probability of answering the question correctly. In 2003, 14% of adults fell into the below basic category. This means they could not complete a task as simple as finding the date of their next appointment on an appointment slip or identify pre-procedure instructions. 14% doesn't seem like a large number, but we are still talking about millions of Americans. The population of adults in 2003 was almost 193 million. If 14% of them fell into that below basic category, that means that over 26 million Americans could not follow basic health instructions. Like I said, this data set is from almost 20 years ago. If we assume that literacy levels have remained somewhat constant, then with the current adult population of over 214 million, the U.S. is looking at almost 30 million Americans being in the below basic category. Low health literacy can affect anyone, but it is more prevalent among the elderly, minority populations, those with low socioeconomic status, and medically underserved populations. We touched on this earlier, but it's important to know that having low health literacy affects people in multiple ways, including, but not limited to, the simple act of locating providers, services, and preventative care, filling out health forms, sharing accurate medical history with providers, knowing the connection between risky behaviors and health outcomes, and managing existing health conditions and understanding medical directives. Factors such as the use of jargon by healthcare providers, low education levels or low English proficiency, and cultural barriers can all affect how patients receive and process information, and in most cases, more than one of these barriers will apply to an individual patient. So we know who is most likely affected by low health literacy, but the old adage, you can't judge a book by its cover, definitely applies here. When assessing health literacy, there are 5 key factors that we need to look at. Communication skills. Does the patient have trouble verbalizing their thoughts or pronouncing words clearly? Comprehension and cognitive skills. What is their reading level? Are they able to apply critical thinking and problem-solving skills? Numeracy skills. Do they have the basic math skills to follow your instructions for tasks such as reading nutrition labels, interpreting their blood sugar readings at home, or administering the proper dosage of medication for themselves or their children? Do they have the self-efficacy to follow through with care at home or seek out healthcare when needed? And finally, what are their information-seeking behaviors? Do they know where to go to get reliable information? Do they get most of their information from social media? Do they rely on friends and family members? All of these factors will come into play and affect how your patient manages their care when they leave your office. There are countless available tools to help clinicians and healthcare professionals measure someone's health literacy level. Let's briefly take a look at a few of them. This is the Rapid Estimate of Adult Literacy in Medicine, or REALM test. There are multiple formats of this test, including a teen version, a short form, and a Spanish version. If you're not familiar with this test, the administration of it is pretty straightforward. You give the patient the list of words, ask them to read the words, record their score, and assign a reading level accordingly. The score will tell you the likelihood of the patient being able to read the material you give them. Though possibly the most widely used, as with all assessment tools, there are issues. For this test, you can get an idea of the patient's ability to read medical terminology, but unless you dig a little more, you will not know if the patient can actually comprehend the words. The second tool addresses another major aspect of health literacy, which is the patient's numeracy comprehension. This is a general health numeracy test. Similar to the REALM test, you can get a sense of the basic skills of the patient, but there are issues with using this test alone. For example, question 6 will not be relevant to a male patient with diabetes. They may be able to solve the problem, but how do they apply that information to their lives? In addition, these problems are fairly wordy and can be confusing or intimidating for people who have low general literacy levels. By using tools such as these, you may get a better understanding of your patient's literacy level, or they could just be really good at taking tests and make you think that they fully understand. So let's look now at how we can begin to improve our communication. One of the most important aspects to address when talking about health literacy is cultural awareness in communication. The definition of culture is attitudes and behaviors which are characteristic of a group or community. Being culturally aware enables you to interact with your patients in an unbiased way while being aware of and respectful of all the different cultural aspects that make up the whole patient. Culture is a term that encompasses race, ethnicity, religion, socioeconomic status, being part of the LGBTQ+ community, people with disabilities, belief systems, traditions, and more. And we know that one person can be any combination of cultures. So it is our jobs as providers of information to consider as many aspects of a patient's identity as possible when providing information to them. The cultural groups that we are either raised in, become a part of through chance, or choose to be a part of influence our worldview, how we communicate, and how we process and use information. The next part of cultural awareness is developing cultural competence. Cultural competence is the recognition of and respect for different cultures coming together at the organizational level. Cultural competence can be providing interpreter services, recruiting and retaining minority staff, providing training to increase cultural awareness, knowledge, and skills, coordinating with traditional healers, utilizing community health workers, incorporating culture-specific attitudes and values into health promotion tools, and including family members in healthcare decision-making. Now, depending on your position in your organization, the ability to make some of these changes may not be in your control, and that is understandable. But how you provide information to and interact with your patients is. Examples of being culturally competent can include not being dismissive when a patient expresses a desire to incorporate traditional healing practices into their treatment program, not launching into a consultation on different types of birth control for a female patient who is lesbian, or if you have a patient who has a disability, ensuring you are speaking directly to them and not their caregiver. These simple acts show respect for your patient's culture and values and help to establish those trusting relationships we all want. As a healthcare provider, you know the communities you serve. If you see an opportunity and have the ability to provide services that would enhance cultural competency, adding these services will likely increase the health literacy of your patients and therefore the overall health of your community. Obviously, your job as a healthcare provider is not to tell people how to live their lives. Your responsibility is to communicate the information to them so that they can make the best decisions for themselves and their families. Let's now take a look at your role as a healthcare provider and explore actions that can be taken to improve the health literacy of your patients. Let's look again at the definition of organizational health literacy. It is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. If you take nothing else away from this webinar, I want it to be remembering the phrase equitably enable. Organizations need to equitably enable patients to find information. There is a ton of information out there. Just like you need accurate and reliable resources when you're doing research, your patients need to be able to find accurate and reliable information about their health conditions. Next, they need to understand what they have found. Remember the realm test we looked at? Just because I can read a word does not equate to my understanding its meaning. As a healthcare provider or provider of information, we need to make sure that individuals understand the information being given to them. You may tell me that I have high cholesterol, but what does that mean for my overall health? And finally, how do they use this information to make informed decisions for their health and that of their family? Having access to information isn't enough. If I have access to a car, but I don't know how to drive, what good is the car going to be? So let's take a look more at what it means to equitably enable. We have learned that with regards to health literacy, just as with individual health, no two people are the same. Therefore, it can be concluded that the needs to reach understanding will be different patient to patient. It's not enough to provide everyone with the same materials. That is equality, which is a good first step, but it's not going to get the job done. Looking at this picture, you can clearly tell that everyone has different needs to see over the fence. If you give everyone a box, you've provided each person with equal materials, but their needs are obviously not met. When we flip the script from equality to equity, you're providing each person with what they need to accomplish their goals. This is a fundamental practice in health literacy education and one that needs to be kept in mind always. So, how do we equitably enable patients and those seeking information? Through observation, adjusting our approach, and then taking time to educate, we can empower patients and information seekers to make informed decisions regarding their health and that of their family. So let's break these down one by one. The literacy and numeracy tests are great tools to have, especially when we're doing research and we need a standardized form. But in your practice, a lot of what they reveal and so much more can be done through observation and asking follow-up questions. It sounds easy enough, but by simply acknowledging diverse attributes such as age, language, culture, race, and ethnicity, and gathering more information by asking questions, you not only learn a lot from your patients and can begin assessing their needs, you also begin building trust and establishing lines of communication. Once you've assessed what your patient needs, you can adjust your approach. One of the best practices for health literacy is communicating in a way that anyone can understand. When information is clear and easy to act on, patients feel more involved in their health care, and involved patients are more likely to follow through on treatments and enact healthy behaviors. One issue that comes up time and time again in patient interviews is that their doctors used language they didn't understand, and they felt uncomfortable or even stupid asking questions. Start by using simple language. Avoid jargon and acronyms. Simple switches such as saying stomach instead of abdomen or not cancerous instead of benign will give the patients the information they need in a way that they can fully understand and that is also not patronizing. Use simple, plain language sentences. Even simple phrases such as change your dressing, your test results were positive, or we need to draw blood can be confusing to someone with low health literacy or who doesn't speak English as their first language. Keep information at need to know. Too much information can be overwhelming, and people can get lost in it very quickly. Be objective and non-judgmental. Rather than saying, you've been non-compliant, state the facts. Instead, you can say, I see that you haven't been taking your medication. You're still getting your point across, but the patient does not feel belittled. Another form of adjustment is the use of alternative or supplemental materials. Providing supplemental materials can help your patients better understand a variety of topics. Videos, tables, or pictures, in addition to written instruction, can enhance your patient's understanding of their condition or what will be expected of them during treatment. Perhaps one of the most important adjustments you can make will be providing information to your patients in their native language. Translation apps are great, but there's always something, lost in translation. Phrases like, let's put this on the back burner, quit cold turkey, or are you feeling blue are going to be confusing to someone who is not a native American English speaker. Providing information in a patient's native language allows them to be more involved in their care. And finally, educate. We don't want to just give people information. We want patients to learn the information so that they can act on it. One of the best ways to do this is to use the teach-back method. All the teach-back method is having a patient tell you in their words what you've just told them. Rather than asking, do you understand these instructions, you ask them to show you how to do what you've just explained to or shown them. This works especially well for actions that need to be taken, such as interpreting a blood sugar reading, changing a dressing or bandage, or administering medication. Teach-back is also very useful with a new diagnosis. Asking a patient what they know about a newly diagnosed chronic condition will not only give you a sense of where to start, but could offer insight into their level of dedication to treatment and health literacy levels. Teach-back is all about asking open-ended questions. Can you explain this to me versus do you understand what I just told you, or does that make sense, will elicit very different reactions from patients. By being culturally aware and incorporating the observe, adjust, and educate steps, regardless of your background or that of your patients, you can begin to empower them to make better health decisions. The next few slides, we will go over available resources for you as a provider, as well as some that you can provide to your patients. The CDC has an extensive section on health literacy. They cover the basics that I covered here today and they provide resources for creating a health literacy plan, links to available research, and more. If you're interested in measurement tools like the REALM or Numeracy test, the Agency for Healthcare Research and Quality has a page dedicated to these tools. Additionally, Boston University has compiled the Health Literacy Toolshed that has 210 different tests with corresponding administration guides. You can search by context of the test, such as HIV or vaccination, or you can search for a specific language. The CDC also has a tool for avoiding jargon. Sometimes we get so caught up in how we're supposed to say something that we forget that not everyone has had our experience. Everyday Words for Public Health Communication is a useful tool to combat this. It is not an all-inclusive database, but it is a useful resource. You can either type the word you're looking for into the search box or browse the A to Z index. You're given the word, synonyms for it, and then the word used in both a professional and plain language sentence. StatRef is billed as a full-text, cross-searchable information resource for the healthcare professional, specializing in full-text book titles with fully searchable chapters and sections. I want to specifically bring attention to the section for point of care in the drop-down menu and the American Academy of Physicians Conditions A to Z. On the left, you can see the A to Z listing, and if you click on them, they expand to show the conditions. What's great about this resource is that it's written at an easy-to-understand level in English and in Spanish, and can be printed and given to patients so that they can learn more about their conditions. Also, most of the conditions have a questions to ask your doctor section, which can help in building communication between you and your patients. If you are affiliated with U of L, you have access to this database through the Kornhauser website. If you are not affiliated with U of L, you'll have to check your institution to see if they have access. If you need to design printed or digital materials, the AHRQ has a toolkit that thoroughly covers written communication, along with a guide for health literacy A to Z. And finally, for more on cultural competency, ethnomed.org is a fantastic resource that you can use to learn more about the medical issues, cultural beliefs, and practices for immigrant and refugee populations. And directing your patients to reliable resources is also very important. We know the horrors we can find when we just take to Google to see what's out there, especially if we don't know how to critically evaluate sources. Medline Plus is an excellent resource to send people to. It is written at a 6th to 8th grade reading level, and information is presented in a way that's easy to follow. Medline Plus is especially good if you need some quick, basic information in a language aside from English. Information is available on a wide range of topics in multiple languages with the English version alongside, so you know exactly what information you're giving your patients. The CDC is another good resource that your patients can explore to learn more about diseases and healthy living. With an easy-to-search interface, you can quickly show your patients how to find information. They have articles, videos, podcasts, interactive maps, information on local partnerships, toolkits, and much more. The U.S. Department of Health and Human Services Office of Minority Health has a section entitled My Health that focuses on helping minority populations learn more about healthy lifestyle and how to access care. This list of resources is by no means exhaustive. Please feel free to reach out to me if you want additional resources or need resources for a specific population. So wrapping up, we have discussed the evolving definitions of health literacy and how the current definition has brought focus to the relationship between the provider and the patient, how imperative cultural competence is in building trust and establishing lines of communication. We reviewed how to empower your patients in their health decisions by employing the observe, adjust, and educate steps. And I've provided a list of resources that will get you started. I want to thank you for watching. Please take a few minutes to scan the code on the right and complete the brief feedback form. You can also scan the code on the left for my contact information. Please feel free to reach out to me with any questions you may have. Thank you.